I was just looking for you. Can you help me apply a partial rebreather mask?
Of course. What's the situation?
Well, my patient has had some changes in his respiratory status, and his oxygen saturation has dropped to 89%. So his nurse called the doctor ordered a mask, and with an oxygen flow rate of 10 liters per minute.
Okay, that's fine. When you're putting it on, it's important to make sure that the mask fits snugly around the patient's face. If it's loose, it will not effectively deliver the right amount of oxygen.
Right.
And be aware of meal times because...
Because the patient can't eat with a mask on.
Exactly. So there should be an order for oxygen via nasal cannula during meals. But because the amount of oxygen with the cannula will be less than the mask, return to the mask immediately after his meal.
Okay, should we go?
Yeah, let's.
Hi, Mr. Simon. This is my nursing instructor, Miss Lewis.
Hi.
Your doctor wants us to change the way we're giving you oxygen, so I'm going to put a face mask on you, and this is going to give you more oxygen and help you breathe easier. Okay?
All right. I guess if you spoke to my doctor, I will.
Okay. I'm going to check your ID band. Can you tell me your name?
Robert Simon.
Okay. I'm going to listen to your chest. Is that okay? On for a minute. Just take some deep breaths, if you can. Okay, Mr. Simon. We're going to get the face mask connected to the setup, okay?
Okay, remove both flaps from the mask.
All right, I'm just going to lay this right next to you. There we go.
Once you've adjusted the flow rate to the ordered amount, be sure to let the bag fill up with oxygen prior to placing the mask on the patient.
Right, of course. All right. Okay, I'm going to put the mask on you now, Mr. Simon, okay?
Okay.
We're just going to take these out. Right. Right here. Put this on you. And it's here to protect your ears. Can you look at me? How's that feel? All right? Okay, everything looks great. So, right, I'll document, including my assessment, the type of mask used, liters per minute flow, and the patient's reaction to the procedure.
Great. Now, skin integrity can be compromised due to moisture and pressure under the mask. So regular assessment of the area under the mask is an important part of care.
Right, so I'll remove the face mask and dry the skin every 2 to 3 hours and check for any skin irritation.
Good. And powder should never be used around the mask.
Got it. Won't touch the powder. I'm going to stay with Mr. Simon, make sure he feels better, and recheck his oxygen level. Okay, Mr. Simon?
Sounds good.
Okay. I'll be back to check on you both.